So it is my incredible pleasure to welcome everyone to We Are All Data People, an equity-centered approach to increasing impact. And on behalf of the MasterCard Center for Inclusive Growth, St. Louis Regional Data Alliance, data.org, the Social Policy Institute at WashU, and an amazing collection of collaborators, partners, friends, colleagues, and beyond to be joining the space together today. So we're committed to meeting people wherever they are on their journeys, working in and around equity and community-centered data practice, strategy, and organizational culture. You may have noticed we are in a Zoom meeting, which is a very deliberate and explicit choice that we're making today to give people the chance, based on feedback we've gotten, to be connected with each other, less so on the anonymous Zoom webinar format. So you'll please forgive and work with us, as we will also, if someone forgets to unmute or do something of the sort, but we'll roll with that as we make our way through our program today, to be sure. So all of that said, to welcome and to kind of situate us in what we are embarking on, we wanted to share back some of the information that we gleaned from folks signing up for the event. And a really great snapshot showing the diversity of people and their interest and their current role in relationship to data. Significant number of folks working in and with nonprofits or governments, and then also thrilled to see such significant, robust interest from the St. Louis social sector, as well as more broadly from national and global audiences as well. So we recognize and truly appreciate the incredible number of polls on people's time and your attention, and are truly energized to see such great interest from the social sector, both in St. Louis and beyond. So to welcome and bring people together to open up today's event, we ask for everyone to navigate over to a short introductory activity, which my friend and colleague, Jen Rose Fitzgerald, is going to be putting in the chat for people to move over to. So folks might be familiar with this platform already. So my video seems to have froze. Generous, can you still hear me? Okay, terrific. So I might just be a profile picture while we do this exciting exercise. But so folks might be familiar with this platform already. What we're asking for folks to do is to please share one word to describe yourself. One word that comes to mind, and however you'd like to identify to describe yourself in the space today, to introduce yourself and to start to get to know some of your peers in the space. So these are going to fly in fast and furious. So we see mother, curious, student, advocate. Communicator, introspective.
Where are you out?
Oh, I know where you are.
No.
Let's see, we also have some in the chat: dedicated, questioning, kind, optimistic, spunky.
I don't see, but have to imagine, to be a little meta, on mute, not on mute in terms of our current status in the meeting. Dedicated, public health, resilient, reliable, strategist, playful, calm. It's amazing with 125 people together today to get a visualization of how folks are identifying and describing themselves as we're entering the space. And for me, hopefully I'll be able to say on camera again in just a moment, if that will start working again. All right, there we go, and we're back. Okay, so technical glitch number one out of the way. So you have to have one always at the start of a exciting event, to be sure. But so thank you all for just contributing to the discussion already and just sharing a little bit about yourselves and for creating a space and a community for us to spend together over the next 2 or so hours. So to move us along in our program today. So
Again, we're seeing quite a number of familiar faces and quite a few new faces into the work and into this initiative. So as we are coming together, just a couple of centering remarks and thoughts about the Data Science for Social Impact initiative. Our objective is to develop trainings and resources for St. Louis social sector organizations seeking to utilize data more effectively to increase impact and promote equitable outcomes. So as we've seen, most learning opportunities that are currently available around data science for social impact have been more technically focused, geared towards aspiring data scientists, and not necessarily reflective of the unique opportunities for the social sector. So for informing today's event were multiple roundtables that had participation from over 100 organizations, speaker series that highlighted local examples of leadership and grappling in data science for social impact, and engagement with a wide range of colleagues and organizations doing significant work. Notably, this initiative is based at the Social Policy Institute at Washington University in St. Louis, whose mission is to foster interdisciplinary and cross-sector collaboration to design, test, inform, and impact innovative policy solutions. A number of our SPI and WashU colleagues are in attendance today and joining us as speakers, facilitators, and champions of our focus that we are all data people. In addition to our WashU colleagues here today, this initiative is made possible by support from the MasterCard Center for Inclusive Growth and a deep partnership with the St. Louis Regional Data Alliance and data.org. And so with that, I'm happy to turn things over and welcome our first speaker of the event and invite Shanna Crumley into the space to say a few welcoming remarks. So Shanna is the Director of Impact Data Science at MasterCard, and so very pleased for her to be joining us today.
Thank you, Dan, and hi everyone. It's lovely to meet you, to see some of you again, and to meet some of you for the first time. As Dan mentioned, I'm the Director of Impact Data Science at MasterCard's Center for Inclusive Growth, which is the philanthropic hub of MasterCard. We're particularly focused on financial inclusion, inclusive growth across this space. At MasterCard, we know that building an inclusive economy, which is something we're really interested in, requires equitable access to the technology, the data, and the digital networks that can benefit all of us. And within that, of course, we believe in this transformational power of data to be able to unlock those solutions and to help us solve society's most pressing problems. The social sector, and including many of our grantees and partners, is on the same page, where we've all seen firsthand how crucial data is in solving problems and in doing so equitably and inclusively. And we've also, of course, seen the opposite of that, right? But we don't always have the right combination of resources, the skills, the time, the technical talent that we need to get to where we need to be, which is to this level of data infrastructure, responsibility, standards, having tools, and having capacity at the end of the day that we need to be data informed, to be data driven, and to be data led as a sector. One of the reasons that MasterCard in particular is so focused on this is that this is an area where we saw that our expertise in data, analytics, technology, and delivering these data-driven insights could help in building this field. So we're really focusing our efforts on what we call building this field of data science for social impact. Whereas you'll notice in my title, we're also calling it impact data science, because we see this as going forward as an entire field like impact investing, right? Where this needs to be a priority and a focus and just kind of a mainstream, right, a thing, right? But as we're building this field of data science for social impact, we're taking an ecosystem approach that's empowering the private, the public, and the civic sectors to push this frontier of data science to that point. We're particularly emphasizing this year, especially, I'm new to this role, so scaling up some of our partners like data.org, Ginger's on the line today, an incredible partner, DataKind, Benefits Data Trust. So folks that are trying to do this scaling up of this field where it's capacity, it's bringing people together, it's setting forth these concepts, these ideas, and the plan for the field going forward. We're also really focused on capacity building for decision making. This relationship with WashU is a definite indicator of that, and being able to equip folks like you to be in this space from every level of your organization is one of these goals. Another thing we've done in this area is something called the Inclusive Growth Score, which I think it might be interesting to some folks on the line for measuring social and economic equity at the census tract level. And then ultimately, we're just trying to ensure that the tools and the people and the evidence base is there for this to be, for the future of this field, right? And one thing I do want to mention on this, and I'm sure we'll hear more about this later, but the Data Maturity Assessment Toolkit was just launched last month, and it's huge. Data.org and DataKind have partnered on this. And I wanted to mention that because I think that that's exactly where we're trying to go with the field at large. Where we're trying to create things that will meet you where you're at, be useful to you, but also help you figure out how this, how your organization is a data organization, right? And we are all data people. So how that can really grow as you grow as an organization, as your mission grows, and as your reach grows as well. As we know, nothing can be done alone in the social sector. It's the sum of all the parts. So we're really excited to be working together. And I think it's the same, it's true for this data science for social impact area. So that's, I think that we need all people to be data people, and we're really excited to be partnering with you on that. And yes, to answer the question in the chat, I did say data.org. Thank you. Back to you, Dan.
Thank you, Shanna. Masterful, both presentation as well as simultaneous navigation of the chat, which is something that all of us are working on in our Zoom lives, to be sure. So thank you again, Shanna, and for the MasterCard Center for Inclusive Growth for your leadership and your contributions, not only to this initiative, but to the area more broadly. So I'll say a quick few words just in acknowledgement of our amazing partners at the St. Louis Regional Data Alliance. And then as Shanna foreshadowed, we'll be hearing from our friends and colleagues at data.org later on in the program. So the St. Louis Regional Data Alliance is led by Paul Sorensen with the support of a robust steering committee and hundreds of local members. The RDA launched in June 2018 with a focus on community data, and their mission is to build shared data infrastructure and support strong data actors that use quality data to improve people's lives. So as we look at this conceptual model, we very much share and put into practice RDA's vision and approach that data is about people. In addition to some of our institutional and organizational colleagues and friends, we are supported and so fortunate to be partnered with an advisory committee of local and national data science and social sector leaders and innovators and thinkers. So this group formed mid last year and has been so instrumental to helping us think through our values and vision for the initiative, for helping to inform our programming and offerings, all the way to thinking about how are we measuring success to be sure as we are advancing in the months and years ahead. So a very heartfelt acknowledgement to the folks on this screen, again, some of whom you'll be hearing from more, not only today, but in the learning events that we have planned for the months ahead. Speaking of that, it is my pleasure to turn things over to one of our amazing advisory committee members to talk us through those values and that vision for the initiative, as mentioned. So I'll be glad to welcome Ali Chang-Ray into the space.
Thank you, Dan. And thank you for allowing me to represent the advisory committee as part of setting up our values that really help center us on the work for today and then moving forward as well. So as a member of the advisory committee, I want to welcome you to today's session. And I want to do that by sharing these values that you see on the screen. I'm not going to read through all of them because you're able to see those yourself. But I do want to draw your attention to the heart of this slide, which is right there in the middle, that shows that our work centers on community engagement and racial equity. When we think about the DSSI's work and what this means to us, these are data-informed values that we've helped put together because we recognize that they ground the social impact sector. And just as we talked about the assessment tool that data.org is going to be introducing, walking everyone through later today, as well as all the other tools, resources, and information that are coming to you. And we want you to know that we run everything through this centering, through this filter. And so that is our promise. Also, as part of our promise, the advisory committee helped hone these values. And so for me personally, as an early stakeholder, I participated in an interview, and during that interview, I voiced that it was really important to meet everybody who's interested in this work and where they are, because we're all across the spectrum. Some of us beginning, some of us very mature, and many of us somewhere in the middle, right? And we keep evolving. So when I was invited to join the advisory committee, I said yes, because I wanted to help hone these values, but I also wanted to keep us as a group centered on what is in the middle there with the community engagement and racial equity. So it's the advisory committee's intent to be data informed and to do this while we are being equity driven and community driven. And so we want to promise to you then that we're going to strive to reflect these values in every single thing that we do. This is our commitment to the work, and we want to thank you for moving forward with us so that we can advance the data ecosystem. So with that, I'm going to turn it back over to Dan because we've got many more exciting things to share with you during our time together.
Thank you so much, Ali, for your words and helping to center the values and vision of the initiative and your contributions all the way back to the beginning of those very early stakeholder engagements and interviews that we were having with colleagues. Feels like just yesterday, but also like years ago. All of that said, I also want to invite another amazing colleague and friend into the space as we transition into our keynote for today. It's my pleasure to welcome Fannis Thomas, who is the Associate Director for Policy and Strategy at the Social Policy Institute, who will say a few words as well as introduce today's keynote.
Thanks, Dan. So hi and welcome everybody to this kickoff event. We are very thrilled that you are here. So personally, it is an honor to be involved and in community with all of you at this event. I don't go as far back as Ali, but I had the opportunity to engage in some of the initial discussions about DSSI. And a lot of the conversations in the meetings that I was in centered around our stewardship of data and how we can best use it to advance policies and conversations and practices that benefits and more importantly do not cause further harm to the communities that we work with and that we aim to serve. And those were things that resonated really strongly with me. And as the new Associate Director of Policy and Strategy at SPI, I look forward to being more involved directly in the DSSI work and also to continue sharing and learning from and with all of you. For now, it is my pleasure to welcome our keynote speaker for the event, who is Dr. Dwayne Proctor, who is the President and CEO of the Missouri Foundation for Health. Dr. Proctor is probably well known to some of you at this point, but he's a respected leader and national expert on health equity with nearly 20 years of experience in philanthropy. Prior to becoming the President and CEO of the Missouri Foundation for Health, in 2021, he held multiple roles with the Robert Wood Johnson Foundation, where he provided strategic guidance and resources for several child health and risk prevention initiatives. In his career, he has always been passionate about ensuring our communities are flourishing and healthy, and his experiences working with marginalized communities have helped shape his bold vision for achieving health equity in Missouri within the next decade. In advancing the mission of the foundation to eliminate the underlying causes of inequities, transform systems, and enable communities and individuals to thrive, he has prioritized becoming acquainted with the systems in the Missouri environment that have long since kept individuals and communities oppressed and presented barriers that have prevented them from developing to their fullest. It is precisely his commitment to centering equity and community that inspired us to invite him to this space today. And we are looking forward to his keynote. And so without further ado, please join me in welcome Dr. Proctor.
Thank you. Thank you so much, Ms. Thomas. I'm so happy to be here. And as I was preparing for this presentation today, I gave a lot of thought to what makes me a data person and when was the last time I was a data person. And it takes me back to March 17, 2020. I think we all know where we were that week when our country began to shut down because of the COVID-19 pandemic that was coming across our country. I was living in New Jersey at the time, and then I think it was 2 weeks later, Monday the 30th, that I received a phone call at my office. It was from a colleague in Washington. And if you recall, at the height of the pandemic, there was a lot of uncertainty in the air There was a lot of activity that was going on to do our best to address this new scourge that we are all facing. And then in all of this, the phone call came through and my friend said, Dwayne, I don't know if you know this or not, but no one's collecting demographic data at COVID testing sites. And I said, that can't be true. He says, no, absolutely true. Somebody needs to do something about it. And he was very emphatic about it. I have a lot of friends who are advocates who are just emphatic about things all the time. And so I made a couple of phone calls. I called HHS, I called CDC, and they said, no, we're not collecting that kind of data. And we actually need to, we understand the need to do so, but we also need to be pushed to do so, which is where my advocate friends come in. We put together a 30-day campaign around this need to collect demographic data at testing sites, focus primarily on Capitol Hill in Washington, D.C. We wanted legislators to know and understand that collecting this demographic data was important. As campaigns go, it went very rapidly. In 30 days, we went from uncertainty to having congressmen and women and senators and representatives all formulating a document that called for the need to collect this demographic data. It passed in both the House and the Senate. And today it is the law of the land that CDC and HHS have to collect demographic data at testing sites and report to Congress once a month. It was a victory that we could not have expected so quickly. But it was important that this happened so quickly, because if you recall the news at the time, the news was saying things like African Americans are dying disproportionately of COVID-19 and others as well. And that news was part of the campaign to draw attention to the need to do so. The data, just collecting demographic data at testing sites, this was well before we had vaccines, well before we knew the value of masking in our new environment that we're going to work in. And this data now is still reported to Congress once a month, but now also includes demographic data on vaccinations and who's being vaccinated and what needs to happen. Without this data to help inform making decisions, we would have totally missed the inequities and the disparities that were part of the systems that were in place when we started thinking about the pandemic. And so it was an exciting adventure for me to be a part of that. I enjoy data. I'm a social scientist by background and training. And it also is what attracted me to the Missouri Foundation for Health. At the Missouri Foundation for Health, we've been exploring new frontiers in generating, analyzing, and communicating the value of data to meet our goal of achieving health equity in Missouri. It was exactly those three tenets that was a part of the campaign that we did on Capitol Hill in Washington. So coming here was easy for me to want to do. I was very happy to get the job, and I've been happy ever since, because this is the kind of place that I like to be at, a place where we deal with the complex issues that face us in a way that makes sense. So when we look at this issue of data, what we're doing now is starting to give thought about how do we reorder data science itself? How do we have a revolution of sorts in how we think about the how, the why, and to what end do we collect and analyze data? Maybe data science doesn't sound like the terrain of revolutions to you, but we see it differently. We're data people and we see it differently. And we want to be in thought partnership with others who understand the value of generating data, of analyzing data, and communicating the value of that data as important decisions are being made. So the questions that preoccupied us a decade ago, like how can we get more disaggregated data to tell the story of health disparities? How do we make efforts to democratize data so that the data is in the hands of more people? How do we make certain that we bring communities along with us as we are generating, analyzing, and communicating the value of this data? And those were the questions that plagued us, so to speak, a decade ago. And from all indications, our needs for data in Missouri are apparently slightly different than those questions I just raised. Last year, MFH commissioned a research project that was conducted by We All Count. I know We All Count is here with us today. We thank you so much for this because it was very helpful to us. Now, this research project asked data scientists health advocates, researchers, and data consumers in Missouri about what they want more of in the future. Now, I'm sure some of you can contributed your views to that research, and we thank you very much because, again, all data counts, all data gets put to use. And for those of us who respect data very much, we also respect the folks who give us the data that we need to work with. However, one message came through strongly and clearly, and that was, and I paraphrase here, frankly, I don't need another way to know that we have a lack of health equity. I need a tool that can point out ways to invest resources that will make a difference. This notion that came from this data, this notion is one that we've sat and pondered quite a bit. And so in preparing for this presentation, I asked our staff of experts how does this notion position us for new research questions for our future? And different from other keynote addresses, I'm going to tell you those questions. And then as we go into Q&A, if you have any thoughts or opinions about these questions, if they're the right questions, wrong questions, or if we're close, not there yet, or if they're spot on, I'd like to hear them. If you want to put those comments in the chat, it'd be very helpful for us in our planning. And so there's about, let me see, 5 questions here that were generated. So the first one, how should we use data and statistical methods to understand disproportionate systemic and negative impacts of poverty, racism, classism, sexism, and homophobia on Missourians' health without inadvertently applying that those social identities are the cause for these different health outcomes? So that one notion about needing a tool that can point out ways to invest resources differently generated that question. Another question that came up was, how do we structure our analyses so that it does not continually center on the privileged, the wealthy, and frankly, the white experience? When interpreted in our current political and cultural context, this often contributes to equity issues born of white supremacy culture rather than point to solutions that are helpful in equity. So that question was, it's similar to the first one. How do we structure analyses that does not continually center the privileged, the wealthy, and the white experience? A third question that was raised, which is especially relevant to those of us who are interested in intersectional health equity, where our multiple identities are considered as we do our work. What are the most innovative and effective quantitative methods to address the mediating, confounding, moderating effects of social identity when it's not yet possible to disaggregate by all the necessary indicators? How do we do this in a way that where we can still get an effect size that shows us that we have the power to have confidence in the findings that we have? And how do we do so in a way that also doesn't blow the sample size well out of proportion, trying to get to each identity that we need to count on? And how do we do that as well? So that was another question that came up. I'd love to hear what you think about it. And then when it comes to communications, what are the current best practices emerging from my field, my chosen field, communication science, on communicating the nuances of causality to public sector decision makers, especially in a very polarized environment? And finally, what narratives are embedding stories of health equity in assets, potential, and strategies that help us move forward rather than blame stakeholders or foster stagnation? At MFH, we see ourselves as exploring more of this work as we move forward and more towards our goal of achieving health equity in Missouri. That's why I was excited to be here. I hold those questions out to you all to get your thoughts and opinions on. And also, I think there's time for a question or two. And I'm here to be as helpful as possible in answering those questions. Thank you very much for your time. Thank you for this incredible invitation. And I've looked at the agenda. The lineup looks absolutely fantastic. I'm so happy to know that there are data people here in Missouri who are organized and coming together to start thinking about these important thoughts for the future of not just Missouri, but for our country as well.
Thank you so much, Dr. Proctor, for your words, for your leadership, for your vision, and for framing your remarks around questions. and the theme of grappling, to be sure. Some of the questions, in addition to just thanks, and if I had all of the rectangles up, I'm sure all of the emoji claps are going and the celebration emojis and all of the things. But already in the chat, we're getting a waterfall of folks who are saying that this framework, these questions would make a great handout or supplement or one pager. Does that exist somewhere already, or is that something that we can capture following the event to get in people's hands?
I am going to try to cut and paste and put them in the chat. And if that doesn't work, then we will find a way to get these questions to you all.
So appreciated. Thank you for that.
Mm-hmm.
So folks are welcome to put additional questions specific to Dr. Proctor's talk in the chat. He also invited if folks wanted to reflect on any of the points or the questions and how they're being grappled with or discussed or thought about in your own work, in your organization, that is welcomed as well.
A question, Dr. Proctor, I was trying to type it into the chat, but
Sure.
I first want to say thank you for those questions, because I think those are really key questions that we should ask ourselves about data. My question is actually about the research approaches that we use for health data and how we might incorporate, or how should we think about incorporating other research approaches. So by and large, I know quantitative data is used, it's disaggregated, it's something that's important and it's critical, and I'm all for quantitative data and statistical means to show inferences, causes, et cetera, and correlations, and to predict. But I also wonder if there's a stopgap or some sort of in between where we can use qualitative data to build toward those quantitative data sets, or that we could use quantitative data and then use qualitative data, qualitative experiences in order to explain what we're seeing in the quantitative data. That is, how do we get toward a mixed methods approach for health research, particularly around so many disparities that where the N is so low for so many populations when completing surveys, questionnaires, tests because of the inherent bias, but also people see it as a form of sort of, doctors digging into their business. I hope that makes sense. So, but thank you for your comments. They're well appreciated, so appreciated.
No, thank you, Ms. Martin. And I think those questions are fantastic questions. When I was a researcher and doing my work, I always used a mixed method of qualitative and quantitative. I used qualitative to help me understand how the communities I was working in felt about the issues we're talking about. That also helped me to develop the scales that we used in our survey research, because I could understand the language, I could understand their experience, and I could understand what seemed to be off limits or not. And so I think qualitative data can be really helpful on the front end for helping us to shape our studies in a way that really gets to the heart of the matter for the people who we're asking to perhaps participate in our studies for. I also think the qualitative data is very good on the back end, okay? So many times quantitative data gets people's attention, frames a news story, it gets presented to change makers to motivate them, but nothing motivates people better than a good story. Many times, I know we're data people, but let's think of us as regular individuals, right? As data people, we remember data. We keep numbers in mind. We keep the constructs in our heads. For most everyday people, what they remember is they remember the stories. They remember the narratives. They remember the passion that comes through in qualitative information. And it's often the qualitative information that helps to move policymakers to do the right thing. We make all the arguments in the world based on what we learn in our studies and the quantitative applications of those, right? But when we go on Capitol Hill, wherever they may be, if it's Jefferson City, Washington, D.C., or other places, it's the passion that moves the legislators and their staff. And much time that passion for those of us as researchers, sometimes our passion is in the little asterisk that shows us significance. But the passion that's needed with our legislators is just to remind them that our work is about human beings and real lives, and that we're trying to change things for the better that way. So I think there is very much room for both. I just named 2 applications for qualitative data, but there of course are many, many more.
Terrific question, and thanks for elaborating, Dr. Proctor.
Certainly.
Is there another question or reflection somebody wanted to share? So while folks are looking for their mute button, I'll quickly offer in the background. There's been a lot of discussion in our work around this topic and our engagement, and also we've heard in your past remarks, Dr. Proctor, around working to make sure that we have the right people at the table. And I'm wondering if you'd elaborate and talk a little bit about how you've approached that concept and that idea and put it into practice, both previously and now with the Missouri Foundation for Health.
It's probably one of the more challenging aspects of our work is making certain we have the right people at the table as we're doing our work. The benefits of community-based participatory approaches are well known. And we also know from many funding sources that sometimes the dedication to seeing CBPA play out in the best ways possible for funders, sometimes we get fatigued and waiting for change. But the process itself is very, very sound and does move us forward in so many different ways. Generally, and when I want to have the right people at the table, I generally ask who I think are the right people, okay, to tell me who they think are the right people. And then I ask those people who are the right people. So it's almost like a snowball sample, but going 2 clicks beyond my own circle. And where I'm trying to get to when I do that is to, I'm looking for people, you know, we're always going to have a sampling grid of the different types of identities of folks that we're going to look for as we do our work. But what I'm looking for are curious people who also care about the outcomes of a study, who want to take in the time to be there. When we set that table, when we're bringing people from outside of our own disciplines and our own sectors into our work, we also have to plan for more time, okay? And time, not because they're not for any deficits on their part, but people who are entering our space, they have something they want to say and they want to get that out. And we should let them, okay? We should let them, because that's also how they're contributing to the work going forward. And so that calls for patience on our part. It calls for not jumping all the way to the end. Hey, we want to do a study on X, Y, and Z. It means saying we have the ability to do some research on a very important issue in your community. Here are the issues that we think are important. How important does it feel to you? Sometimes doing a casual 25-person survey, what are the top 5 things vexing your community right now? Okay, will help us identify and isolate what seems to be a community priority. And then if we start to do community engagement, we have to authentically want to be there, even if community priorities change. I can't imagine what it was like to be here during the Ferguson uprising. It was a social and societal change that has affected our nation, if not the world. This is one of the flashpoints for Black Lives Matter. And I was very proud to come here and to be in this space. But for those of us who may have been doing work, who may have been working on our surveys and may have been working on our studies and other things, this one societal shift we have to acknowledge, and sometimes we have to flex. And sometimes we have to explain to our federal funders, our philanthropy funders, that, you know what, we really need to flex in this moment, because things aren't the same as when we submitted an application. Things aren't the same as we are. And hopefully those institutions, mine included, will allow grace to try to figure this out as things go on. So one, flexibility, authentically want to be there. Let the community speak, do what you can. And if you do that sample survey of what are the top priorities, share that with the folks you invite in on the table and say, we did talk to some folks And so this is what we heard from them, but then get their opinions and feedback too. Just, be as graceful and respectful as you all have been in inviting me to be a part of this today. That would be my advice.
Thank you so very much for that, for the vision, the values, and then also the actually really actionable guidance for our colleagues on the line who are asking this very question and thinking about the tables that they're convening, that they're being invited to join, and how to think about and lead in these spaces. So very deeply appreciated.
No, thank you, Dan. And this is really important to get right. So I'm glad that SPI is working on this.
Yeah, we appreciate it. So folks would please join me. I know there have been some emoji claps already in the chat, but to thank Dr. Proctor for his time and his words with emojis and real claps and all of the things, whether you're on camera or off camera, just to say a sincere thanks for your valuable time and perspectives and leadership in this area.
All right, I'm clicking through. I want to see everything. All right, it's all beautiful. It's good. Thank you. I appreciate it.
Okay. Well, thank you again. And we will continue on with today's programming as we are just getting started for today. So as I move to reshare my screen, I will gladly actually turn things over to my next colleague and amazing counterpart, Jen Rose Fitzgerald. So for those of you who know Jen Rose is the engine behind so much of this data science for social impact work, engaging deeply with our advisory committee, our community partners, and beyond, lending her expertise and thought partnership in data and science technologies into this initiative. So I'll hand things over to Jen Rose and we'll keep things moving for our event.
Thanks so much, Dan. And thank you, Dr. Proctor, for your remarks. It's just great to share space with so many great thinkers around data and equity. I'm excited to share our framework with you all. But first, I want to give you a snapshot of our process and how we developed this framework. So we knew there was a need for social sector organizations to build capacity around data for all the reasons that Shanna mentioned earlier. But what would this look like? So we talked with social sector leaders about their work and how they were thinking about data and what was really needed. And we started to sketch out some ideas for a framework based on those conversations. And then we formed an advisory committee. And not just those who were data people per se, as you all know from the title of this event, we like to think that we're all data people on some level. But the feedback that we got early on was this needs to be accessible across roles and not focused just on people who are technical data people. And with that input, we then designed a series of public roundtables, which Dan alluded to earlier. And all of this informed our approach and helped us refine this framework, which is an ongoing, continually being refined framework. So that is how we got here. And then based on this input, we are launching this event series and also developing a set of self-paced online modules around each of the topics in our framework. And this fall, we will have a DSSI summit. So these are all of the offerings that will be free and that can help us engage and think about data and equity. So with that, the centerpiece of the framework are these 6 focus areas. And I'm going to walk you through each one of them very briefly. And as I go through them, I hope you will think about what in these areas are most important for your organization to grow in based on where you are right now, because all of them are important. And this is meant to not be chronological. We're going in and out of these all the time, but perhaps there's 1 or 2 that you're really grappling with right now. And so think about that as we go through the slides. And you'll notice the square in the middle, centering community engagement and racial equity across all topics, as Ali mentioned earlier, is something we're really committed to as we pull together resources and events around these areas. So the first one is assess. How can you know what you're doing until you assess where you are? So this is about really identifying where you want to go, where you are, where you want to go, and why. And you're taking inventory. What is your mission? What impact are you trying to have? Do you have the data needed to advance that mission? Do you have the people and the partners and the resources and a plan to make it happen? That is the main focus of the first focus area. The second is cultivate. How can you cultivate a culture within your organization that embraces collaboration and engagement and data-informed decision-making. This means that working with data cannot just be the purview of the data person. There's a culture of sharing and communicating and working collectively. Are there clearly defined roles within your organization around data? This is something that's always evolving over time. This means talking across silos, across departments, across different roles. So that is a really important area as well. The third area is collaborate. Incredibly important for all the reasons that Dr. Proctor shared. Collaborate is about working with community data partners. In the social sector, it is often necessary, as you know, to share data across organizations to achieve the impact you desire, which is great. But in order to do this in an ethical and equitable way, it means asking questions, means bringing the right people to the table. It means asking questions like, what data are we sharing? How are we sharing it? How are we going about getting consent? Who benefits and who decides? So that is a really important focus area throughout as well. Next, we have improve. Improve is about utilizing data to evaluate your programs and your policies and really thinking about, are they having the impact you want them to have? There are needles you're trying to move as a social impact organization. What are they? How will you know if you're moving them? What methods of analysis will get you there? And how will you use what you learn along the way to shape your approach and modify it in order to keep improving? The next one is building infrastructure. How do you build the organizational infrastructure needed to support over time, to support data-informed decision-making? So you're building your staff, you're making sure that people have clearly identified roles around data, which oftentimes may not have been the case when they were brought in. You're building your policies and procedures, and you're building your technology infrastructure. We often think about building infrastructure as just being about the technology, but it's really a lot more than that. That's an important piece. It's also about people and it's about process. And then the last one is engage. And this is the kind of so what of the focus areas. So you have results. What do you do with them? Who interprets their meaning? What stories do you tell with them? How do you translate these results into action? So what sort of policies or practices are you hoping to change? Then that this data will help you do that. So these are the areas. I'll just put them all up together again. And a lot of input went into defining these areas, and I'm sure they will continue to evolve. But we will be holding a learning event around each of these in the coming months, and there will be plenty of opportunities to dive deeper into them. Right now, I just want to step back and kind of take a breath and let you take all of that in and do a really quick poll. When you think about which of these focus areas is a top priority for your organization to grow in right now or in the coming years, months, years. And Dan, would you mind sharing that poll? Thank you everyone for participating. A lot of people joining in.
Folks elaborating in the chat, which is always welcomed.
Yeah.
Or about 2/3 participated. Usually we don't have a method or mechanism or a threshold that we're trying to get to, but we'll give folks just another minute or two before we launch the poll results.
It's difficult to pick just one. I agree with you. It was a dirty trick for us to only let you pick one, but sometimes you might pick a different one 5 minutes later or in a different meeting, right?
These are great. Jen Rose, what do you think we end the poll and share the results?
Absolutely. I think these results are great.
It would be wrong of us to hold the information all to ourselves.
Yes. So what's really interesting is how well distributed these are. You know, we can see, oh, a little bit of bump, cultivated data-informed culture, collaborate, engage, but all of them are really pretty well distributed. And I think that really speaks to that there's a lot of crosswalking across them and that all of them are really vital. So thank you all for participating in the poll. I want to pose a similar question. So we have a few social sector leaders with us today who have been in some way engaged in the making of the framework, contributing to the framework, and either through our advisory committee or by participating in roundtables. And just to hear from a few people there about how do these speak to you and your work? Hold on just a second. So to talk a little bit about this, I'm pleased to welcome 3 social sector leaders. First, we have Esther Shin, who is an advisory committee member and is president of Urban Strategies, Inc., which is a national nonprofit that works in 38 communities with St. Louis as its base. And their mission is to create a world in which all children and families are stable and thriving. I love that mission. And Esther, I'd love to just hear from you about how this framework resonates with how you think about data or something you're grappling with at your organization.
Thank you, Jen Rose, and thank you for the opportunity to talk about how we engage community in data practice. So, as Jen Rose said, our mission is to ensure that all children and families are stable and thriving. And for us, thriving is a family's ability to choose where they want to live, and that choice is not hindered by financial capacity. So, we use housing to leverage human capital and economic investments for community transformation. Our work focuses in 5 areas: education, health, housing stability, economic mobility, and resident engagement. And then 3 large programmatic areas: family support. This is our direct work, which I will speak to. Our CDFI, which attempts to decrease the wealth gap between Black, Brown, and their white counterparts. And policy and influence, which is systems disruption work. We use a framework called Results Count that was developed by the Annie Casey Foundation. That has 5 core competencies. 1 is data, which is critical, very important. 2, act on disparities. This is disaggregating data. 3, use oneself as an instrument of change. This is how we interpret data based on any mental models we might bring to the work. 4 is adaptive versus technical. And then the 5th core competency is collaboration. And this is the one that I really want to sort of hone in on, especially around engaging community and data practice. So our theory of change is that active resident participation is critical to sustaining any positive community transformation. Because the reality of it is that when we talk about data and we talk about collaboration, our biggest and most significant collaborator are the families in which we serve. Because we need data from them, right? Without that data, we can't build strategies. We could, but likely no one would use them, and likely they would not be impactful. So we need the data from families, and we need that data to align with community partners on how best to serve the community. And the reality of it is that we cannot force families that we serve to do anything. We can't force them to give us data. So when we get data, and when we work with families, we very much, our values is that families make decisions on their household on their own terms, at their own pace, and based on their needs. And so our job is to eliminate barriers to obtaining accurate information. So one of the things that we've done is developed a data management system that is focused on the family, that is focused on family rather than a household. It's focused on a family rather than an individual, so that we're able to collect the important data in order to serve families. The reality of it is that much of the data we collect is self-reported. So trust is critical in getting accurate information, especially around things like food insecurity. Who wants to have to admit that they don't have enough food in the home? Or mental well-being. Who wants to admit that it's been really stressful? And trauma. Right? It's really hard to draw out traumatic experiences that families and individuals have experienced that might impact the ability to succeed. Some really strong examples that we've encountered are things around economic mobility, like childcare. We've discovered that a lot of parents, when we ask questions of what is a barrier to getting to work, families will report childcare. And so the reality of it is that it is simple to look at that data just in black and white and put some assumptions around that. Going out and getting more childcare slots, getting transportation to childcare, when the reality of it is that sometimes there's something deeper. And what we discovered is that a significant number of the single mothers that we work with had experienced trauma as children. And so we're untrusting of childcare centers. Another example, school satisfaction with underperforming schools, is what we found is a lot of parents will self-report that they are satisfied with their local schools, even though they are some of the most underperforming schools, either in the principality or the region. And so really being able to build that trust with families to get at what might be behind that kind of reporting, self-reporting that families might be sharing with us. So for us, there are two levels of data. There's the data that we need to utilize in order to support the family, an individual family, and where they want to go, and in their vision for what success looks like for them. And then there is the data in the aggregate to ensure that we're addressing disparities. And this is where we really get to our partnerships, because that data is critical to make certain that we are aligning with partners to develop aligned goals, that we are developing shared performance measurements, which really gets at accountability. And so transparency in our data is extremely important, not just in terms of the public places where we put our data, like on our website or sharing on a monthly basis with our partners. It is also really important that we share and are transparent about our data with the families in which we serve, whether it is the individual household data or the data in the aggregate. So that is how we've really looked at and have tried to address the challenge that is getting data from community and needing to be transparent with how we share it with community. Thanks, Jen Rose.
Thank you so much, Esther. That's great. I really appreciate that perspective. And I know that you have been thinking about these issues quite a lot in recent years, and that you've shared some of this in the previous roundtable discussions as well as on our advisory committee. So thank you for your partnership on this. All right. So next we have Adam Pearson, Chief Operating Officer of Peter and Paul Community Services, who also attended some of the roundtables last year and has stayed engaged in this conversation. Peter and Paul provides housing and supportive services to persons who are homeless, especially those who experience mental illness or live with HIV. Adam, I'd love to hear how this framework resonates with how you think about data or something you are grappling with in your work.
Absolutely. Good afternoon, everyone. It is such a pleasure to be here with you today with colleagues from the St. Louis area and former colleagues of mine at the Social Policy Institute. I'm grateful to have the opportunity to talk through what data means for us at Peter and Paul, and where I foresee data taking us as we grow as an organization. So Jen Rose, to your question, when I think about the focus areas, there are two of them that immediately stand out to me, and it is the build and track focus areas. So Peter and Paul, known as PPCS, is a nonprofit in South St. Louis that walks with people facing homelessness on their journey to lifelong stability. We have two transitional housing programs, a permanent supportive housing programs, and an emergency shelter. We also have an arts program for all agency clients, and a street soccer team called the St. Louis Roadies, who have actually traveled nationally and internationally for tournaments. Our primary focus is housing and shelter, though. At our facilities, the common thread is that we offer not only housing, but also access to case management and supportive services. In several of our programs where we offer more specialized psychiatric supports, we help our clients manage their medications, facilitate in-house counseling or therapy, work on cooking and shopping skills, teach or reinforce skills needed to clean or maintain their apartments, a lot of things that we take for granted. For 3 of our programs, clients can remain housed with us for a period of time, and then they must transition to another setting to allow for more space for others. For our permanent supportive housing program, the tenants have a lease that they can renew continuously if they have the need. So the idea is that they learn some of the skills necessary to live semi-independently, with the assumption that most of them will transition out of the program at some point and have the need for ongoing case management out in the community. So all of this work, the housing, the interactions, the transportation, the facilities, the maintenance, the strategic planning that propels this work, all of it requires a really sound grasp on data literacy and an appreciation for what good data practices can bring to the organization. So in my role as Chief Operating Officer, I oversee all of our programming and facilities and a division of around 50 staff who engage our clients 24 hours a day, 365 days a year, rain, snow, sleet, shine, whatever, we're operating. So between the clinical and housing work that we do and all of our other supportive programming, we have an enormous opportunity to capture what we're doing by managing data effectively. So therein lies a challenge for us as a growing organization with a 40-year history. You can imagine that we've gone through several phases and iterations of how exactly we manage and track data. And right now we're at a place where we've launched an agency-wide outcomes tracking platform that we use for clinical and programmatic data, as well as facilities coordination. Prior to launching this platform, each program tracked all of its data in different ways on different platforms using disparate data elements. So this new system pulls all of the excellent work that we do under the same data elements, with the ability to customize and build workflows that are user-friendly for staff who need to enter in the data. So we are now able to tell a better story about what we do and why we're successful, and we can do that through the data. With this advancement comes challenges, and we recognize that we need a more robust data training process to ensure that all of our current and new staff have access to the platform, know how to manage inputs and outputs, and feel comfortable doing so. There's the added dynamic of having a team of frontline support and clinical workers who are absolutely amazing at what they do, but may not feel completely confident in their computer skills. So outside the actual data work, there's the opportunity to engage in skill building that empowers staff to be great practitioners, great record keepers, and great historians. Outside of those hard skills, we aim to build a greater culture around data appreciation, since it drives the quality of our work, our funding, our expansion strategy. So the work for us is ongoing, and a forum such as this one, where we can come together and discuss strategy and success stories, is extremely beneficial for our organization and hopefully for yours as well. So thank you for having me, and I'm looking forward to the rest of the discussion.
Thank you so much, Adam. And last we have Anna Kent with St. Louis Federal Reserve. And I'll just kick it on over to Anna to keep things moving.
Thanks, Jen Rose, and thank you, Dan, also from SPI and all the others on the DSSI Advisory Council that I'm on. So hopefully you can all see my screen here. So I'm going to talk to you today about how in my job at the St. Louis Fed, we center equity in data analysis. So I'm going to just kind of go through 2 brief points that I want you to get out of it. And so funny, Dr. Proctor's remarks really captured, I think, in a very eloquent and succinct way what some of the points are that I wanted to talk to you about today. So hopefully you remember his remarks if you don't remember mine. So the two things I wanted to cover were just first that headlines can really hide nuance behind the data, behind the numbers. And I'm going to give you an example of that. And you've probably seen it in your own work or, you know, if you're just a consumer of the New York Times or any other news source, you know, you probably experienced this as well. And the second main point I wanted to talk about is that data are basically neutral. Dr. Proctor talked about how the way we pose questions, the way we gather data, and then the interpretation of that data really has an impact on the stories we tell. And that's just so critical to remember the experiences that we bring to our interpretation of the data, because it can impact how the story plays out and then the repercussions in terms of equity that come from that as well. So here, this is just one example of a headline that could be misinterpreted. So millennials' wealth is at an all-time high, and you see that I have 4 asterisks there. This is true. The data show that on average, millennials' wealth is at an all-time high, but the asterisk is, well, what's the comparison? Wealth and income are so very highly correlated with age. So of course it's going to be an all-time high because millennials are older now than they've ever been before, myself included. So if we're comparing across generations at the same age, then it's a little bit of a different story. They have actually less wealth than Gen Xers, for example, at the same age. So for this to say, like, this is just an example, but it really matters what the comparison point is. And the second is, I know not everybody on the call is a data person, but then that's completely fine. As Jen Rohn said, we're all data people, but if it's not your day-to-day, then you might not be familiar with things like correlation and causation and averages versus medians. But you know, talk to a data person in your organization or someone that you can talk to get these nuances, because wealth, as we know, very few people hold almost all the wealth in this country. So that means that an average is actually going to be representative of a rich person. So yeah, rich millennials are doing really well, but your typical millennial at the median is not. And then if you break it down by things like race and ethnicity, you find, even as you would with many other types of things that you look at, many differences there and disparities. And then the second thing I wanted to point out today, and something that I have to check myself with oftentimes, is that data are neutral. So like I said before, the experiences that we come to the table with, the prejudices that we come to the table with, which we all have, just because of our culture, the things that we've experienced, that really informs how we ask questions, but also how we interpret the data. So here's labor force participation rates as of January. And what you can see on the right, those 3 bars, is women without children. On the left is mothers of young children less than 5. And so the green bars are Black women, and you can see that they're basically at the same level. So one potential interpretation of this is that, well, you know, having kids doesn't really impact the labor force participation rates of Blacks. It's not an issue for them. That is a flawed interpretation, but the data are neutral. That's one potential interpretation. And so you really have to think of historical context. And as Dr. Proctor also said, talk to the people in the chat. There was the questions on qualitative versus quantitative data and how those can inform each other. Versus, for example, the blue bars here. So mothers of young children for whites, they have a little bit less of labor force participation. Well, that could be interpreted as, you know, they have more issues than Black mothers do, or it can be seen as privilege, right? That they have the opportunity to step back from the labor force, whereas Black mothers are much more likely to be single mothers. And so maybe they don't even have that option. That's not a choice for them. And they have to balance unaffordable and inaccessible childcare more so than do white. So anyway, I know I'm running out of time here, but that was just to say these are things that I grapple with in my own day-to-day work, and happy to talk more about that in the Q&A. Back to you, Jen Rose. Thanks.
Thank you so much, Anna. That's just great. All of these have been incredibly helpful. And thought-provoking, and I hope people are saving up your questions. We're going to do a Q&A in just a few minutes, but first we have one more person. And before we introduce this last person, I want to share a quick poll, or ask Dan to share a quick poll, which is going back to the first of the focus areas, assess, which is about assessing where you are and where you're going. Where do you see yourself on your data journey right now?
Thanks, folks, for their great answers already. Are you working on the itinerary, packing up the car, cruising on the highway, turned around and or taking the scenic route, mapping out the next leg of the trip?
And no matter what your answer here, our next guest is going to share a tool for thinking about assessing where you are on your data journey and where you're going next. And I know that it will be helpful regardless of where you see yourself right now.
So since everyone is on the edges of their seats, wanting to know where everyone else is on their data journey, and this great trip analogy, again, a pretty great mix to help to segue us into our colleagues at data.org.
And I just want to show great appreciation for anybody who said turned around or taking the scenic route, because we all feel like that sometimes, and it's important to acknowledge, I think.
Absolutely. All right. Should I
Real
share
quick,
my...
let me go on ahead. I was just going to introduce you. This is my pleasure to introduce David Mascarina, who is going to introduce you all to this tool that's already been mentioned today, which is the data maturity assessment, and as well as accompanying resource library. And I know that David has been working really hard on this, and I just look forward to you being able to share it with our group here today.
All right, thank you very much. Let me just share my screen real quick. Everybody see my screen? Excellent. Great. Thank you so much. First of all, I would like to acknowledge all the women in data science as we celebrate Women's History Month this month. And this is such a privilege for me to be part of this group. And thanks for having me today and to talk about how to map your data journey using our data maturity assessment. As Jen Rose mentioned, I'm David Mascarina. I'm data.org's digital content lead. I'm part of the global team that oversees the management of data.org's content development and platform management. For those who don't know, data.org is a platform for partnerships to build the field of data science for social impact. And we work with organizations like you from all over the world to increase the use of data science to improve the lives of millions of people. Okay. Next slide. All right. Now, as you know, the challenge today that social impact organizations lag behind their private sector peers to use data efficiently and effectively to encourage growth. For many, advancing their data journey requires resources, a reimagined approach to data science with social sector, and an understanding where to begin. You know, a lot of people get stuck. Where do I start? And I just want to share some quick statistics with you. You know, 35% of SI or social impact organization C-suite teams are viewed as data literate. 55% of SIOs report staff does have enough experience using data. 54% manually enter data into the system. And you know, you probably share that pain too, many of you. And 69% of SIOs find data sharing across departments difficult. All right. Now, the data maturity assessment tool is brand new. It's launched in February 2012, just a few weeks ago, and provides a snapshot assessment of an organization's data maturity. And it's offering the organizations a sense where they are in their journey of using data to advance their operations and mission. The tool enables social impact professionals and departments to gauge their organization's current state and progress, and to share that progress with stakeholders and community members invested in bringing the organization forward. Now, the findings from this assessment will inform how philanthropy and other social impact sector drivers can invest and ensure the data is enabling an efficient and effective operations and programmatic work in service of your mission. Now, our hope at data.org is that this assessment will serve as a communication tool within organizations like you to share your progress, align areas of opportunities, and chart the path forward in data journey. Now, before we delve into tool, of course, we did a lot of discovery when we started with this project, but we had some key features that we would like to underscore. First of all, we want to make sure that the tool is straightforward. As you know, there's so many assessment tools out there. A lot of them are cumbersome to use. A lot of them are complicated or even hard to understand. The data maturity assessment takes about 12 minutes to complete with clear, concise questions, and it's built from research in consultation with subject matter experts. We have questions that cover all aspects of data practices to provide meaningful picture presented as different sections such as purpose, practice, and people, and the final results page. We thought usability is at utmost important to us. It's designed. The layout is user-friendly on desktop and in mobile, and users can go back and forth between sections and review the answers. And we also created help text, which I'll show shortly, to explain some questions or answers in more detail. And as we mentioned, we want to make sure that the tool is useful and have usable results. I remember when we had early conversation about the tools, like, okay, we don't want to create a tool where it gives you an assessment, then that's it. Now what? But we want to make sure that the tool also provides relative results as well as relevant and tailored resources and guides from our own resource library. So we launched both of them at the same time for that reason. Shareable insights. So not only that you receive the results yourself, that you'll be able to easily share the results with your colleagues, stakeholders, and who would benefit the understanding more about your organization's data journey. And finally, the results provides a holistic snapshot summary of where your organization and its data journey and invites you to dig in deeper and have analysis and available resources through our resource library. Now, the guiding principles, as I mentioned, to build upon, this is sort of our North Star. So first of all, it's built on existing research, and it's supplemented with our own early and frequent engagement with social impact organizations throughout and beyond our data.org network. We brought in subject matter expertise, such as the Social Policy Institute, to drive questioning creation and scoring. And this is, utmost important to us. We invested in user experience design, making sure that the tool is easily navigable and usable. And of course, free the community, not to knock on other tools out there, but a lot of the tools do ask and sell data, to other markets. You need to pay for them, but this we don't make sure that it's free and usable for the community. And then the use of data is highlighted front and center, throughout the journey. Now, as I mentioned, this tool is built for the community and by the community. And here's a little bit of testament to that. Here are the sampling of some of the social impact organizations we've engaged throughout the project. Again, thank you for all, especially Jen Rose and team on this, and of course, like Dan and this is the rest Social Policy Institute. But here's some of the smattering of the different social impact organizations. We looked at organizations large and small across different domain expertise and capacities and capabilities, so that we could kind of gauge and see where how this tool will be applicable to them. Here are some testimonials from folks who went through the tool. Here's Lucio Melito from Give Directly, who underscores how great the tool is and how thoughtful the questions are. This is, again, he's a data scientist, so it's a great validation to our work. Tennille Bowling from Swipe Out Hunger, who commented about the user experience and how this still provides a mirror to Swipe Out Hunger's data collection process. That to us was like a great deal, because we thought like, oh, this is also, it shows how useful this tool is for their organization. And Data.org's fellow and former DataKind CEO, Jake Pore, talks about how the assessment provides a free, intuitive way for organizations to get a picture of where they stand today on your data journey. Now let's begin. I'm going to show some screens from data maturity assessment, and I do encourage you to visit the tool, and we're going to drop it on the chat after this. And here we go. Now, when you visit datajourney.data.org, you'll land on this page, and basically it describes the tool and also describes a little bit about data.org and why we developed this tool, and encourages you to go through. Now, at first, the tool asks for a few basic questions about your organization. This information is not displayed on the results page, and data is not shared with anyone without your explicit and prior permission. We are serious about the ethics around data collection around here, and make sure that we uphold any privacy and security issues. Now, as you move through the tool, you'll find that the questions are divided into 3 dimensions of a successful data strategy: purpose, practice, and people. And your responses are saved along the way. And so you could move back and forth, because sometimes you have to kind of think through the responses. We don't want you to breeze through them, and make sure that you provide a thoughtful response so we can give you a proper assessment at the end. Now, some of the questions might be a little vague. We're trying to make sure that we try to be as clear and concise, but of course, there might be times where it might be some additional explanation. Here's an example of a screen where, we provided some handy tooltips to gain some context and information at any time. And this will not interrupt your progress when you click on them. And, hopefully that this will be helpful as you go through the tool. Now, as the assessment measures data practices across 10 data competencies like strategy, leadership, infrastructure, security, and ethics, these competencies are grouped under 3 major buckets I mentioned earlier: purpose, practice, and people. Now, here's the screen for people, like how your organization have leverage the people power skills and mindset to drive your service, your mission, and how that plays into your data maturity. Now, and finally, in total, as I mentioned, it takes about 12 minutes to complete. And here's an example of the screen of one of the folks that completed the assessment. And here you arrive in the results page, which shows your organization's data maturity score based on your responses. Now, I would like to underscore that this is a point in time assessment. And of course, this is a good way to see where you are in your data journey. And of course, as you take this on and your data journey, this score may shift a little bit. Now, here's an example of as you delve into the results page, it kind of gives a little bit more, it actually gives a little bit more detail about each of the section. Here's an example of a purpose and how this organization that did relatively well on the purpose, but they also delves in, it's like, okay, how did they do on application analysis and strategies? You could see their strategy, they're 7 out of 10, but it looks like their analysis is a little bit lower and 3 out of 10. And then based on that, we serve resources based on that score. So because of that, it looks like they advanced more on strategy. So we've served up artificial intelligence social good guide because they're a little bit more advanced there. But they may need additional help on application. So we provided some guide on data visualization to help them with that. And also like to underscore too that the results page is designed to be shareable and printable. So there's a print button. Actually, I'll go back real quick on that screen on the upper right-hand corner. trying to figure out where the point is the print results, and where then it generates a PDF for you, so you could print the results and share it with your team. You could also generate a PDF through that way. Also, you could copy the URL, and it creates a unique URL for you, so you share it with your stakeholders and your colleagues. And of course, if you want to learn more like what these results mean, we provide some tooltips and pages for you to look at. And here's an example of the PDF that it generates, and it's nice, tidy, very high level results. And yeah, and you could use this to distribute, to add to your board packet or leadership meetings, or even take a screen grab of it for future presentation. And that's it. And yeah, and then thank you very much again for your time. And again, I encourage you to visit data.org to see the data maturity assessment, and also look at our resource library. We have over 100 curated resources and over almost half a dozen guides for data science for social impact organizations like you. All right.
Thank you so much, David, for walking us through the tool, and you and colleagues, incredible work putting this together. It was really a pleasure getting to see some of the early versions of this and how it's come to evolve, and hearing already from colleagues how they're working through the tool, thinking about the tool, and implementing it with their colleagues around the table, whether that's a physical table in an office somewhere, or the virtual Zoom table, to be sure. So we'll post the link in the chat if you wanna
Thank you.
And then, so if folks, we're keeping an eye on the chat. I know Jen Rose and my colleague Fanis are keeping an eye on chat for questions to be coming in. So if you have something that you'd like to ask looking back, please feel free to put that in the chat, and we'll get to as much as we can. But before we move into the formal Q&A, just wanted to offer a humble plug for where we're heading next. Especially following David's great talk, as another colleague and partner from data.org, Ginger Zielinski, who's their Chief Strategy Officer, will be joined by Bridget Blunt, who's the Senior Director of Data Initiatives for Baltimore's Promise, and we'll be announcing other speakers and presenters in the weeks leading up to this great event coming on April 6th. Start where you are, mapping a journey toward equitable data practice. So as we'll recall from Jen Rose's great presentation of these foundational areas of equitable community-centered data practice, we have to start somewhere, and we're better to start then with assess. So keep an eye out for the link in the chat, and we hope to see folks back there in the weeks ahead. All of that said, what we've been long waiting for is to invite our amazing social sector snapshot speakers, Esther, Adam, Anna, as well as David, back into the space to engage in some brief Q&A and reflections on the really fantastic topics and the really remarkable breadth and depth of ground covered. So all of that said, we're happy to open up the floor if somebody wants to put a question in the chat, and then we'll have a little bit of discussion leading into our wrap up for the day.
We have a question in the chat. Could you all talk about where your organizations or previous organizations started in your data journeys? Great question.
Zoom Chicken to be one of my favorite games to play. Yeah, any of our speakers?
Well,
go ahead, Adam. Thanks.
Yeah, sure, I can jump in real quick. So as I had mentioned, Peter and Paul Community Services is a 40-year-old organization. And prior to, Excel and all of that, we were tracking certain data points via, notebooks and charts and healthcare charts and all of that. And so as technology progressed, we started doing the things in slightly more intuitive ways, but still each program had a different process by which they would actually track data. And so it started off with just kind of like paper charts and all of that. And then we slowly got some electronic medical record or electronic healthcare record systems, which enabled each program to, track pretty good data. But like I had mentioned in the discussion, it was hard to really make conclusions about whether or not we were accomplishing our goals as an organization when you have all of these different types of platforms based on what the different funders need from us. And so it was really critical for us to kind of reach the stage of maturation where we took elements from all of those different platforms and merged them into the Bell data platform that we use, where we now have similar data elements across the board, and can communicate that as well with all of our funders.
Thanks so much, Adam. I know people are posting into the chat. Again, just thanks to all of our presenters. I'll follow that with a question towards Esther and Anna's rectangles, kind of following, from Adam's remarks earlier on, talking about working with the staff at Peter and Paul around building kind of shared buy-in and support, and thinking about a data culture. And I'm wondering, just what that looks like at Urban Strategies and the Fed, how people talk to each other at these kind of high levels, about data and how it's implemented into action.
So I can go. So one, it's demystifying data, right? Speaking in a common language that is, I don't want to say simple, but relatable. Right? And then we've got a lot of staff that are on the ground and are engaging with residents. And so what I hear a lot of times is, the data is not important to me. And so it's also getting staff to see where data is important. So we have a saying, if it's not in the learned system, then it didn't happen. So if, as an organization, as a staff person, if you want, all the work that you're putting into supporting families, a lot of that needs to be seen in the data. A lot of that is effort, and it demonstrates the impact that staff are making. So it's not just about how much, but also how well. And so being able to communicate that in a way that staff can really, truly understand, and also building the capacity around data across the entire organization and not just for some staff, right? Not just for the executive staff, but at all levels, and no matter what your role might be as well. So our accounting team needs to understand our data systems. It's not just those that are on the front line. So in terms of supporting a data culture, it's that data is important throughout the entire system.
So I'm gonna kind of weave together my answer and answer the first question as well as Dan, your question, and then the question that just popped in the chat a little bit. So forgive me if I ramble on a little bit. So I started at the Fed almost 5 years ago now, and I was actually in the predecessor to the Institute for Economic Equity that I work for now. And so that predecessor came about because of the Great Recession and just understanding how balance sheets were affected and the differences for whites versus blacks, et cetera. And my boss and his partner at the time, they really had to fight to get this center started at the Fed because we're in community development, and the Fed is obviously very macroeconomic focused. And so it was kind of like, well, why do we need to why do we need to disaggregate this and look specifically at blacks versus whites, et cetera. So they had to fight for that. And I say that because organizations are constantly shifting. The Fed just had last year a series that was sponsored by all 12 reserve banks called Racism in the Economy. And that was just something that, from colleagues that have been at the Fed for many, many years would have been unheard of even 5-10 years ago. So the context and culture is constantly shifting. And so in regards to our own biases, I think Dr. Proctor talked about this, but just interpretation of data. So we're always coming to it based on our own experiences And so understanding that there is expertise to be found in places where you might not traditionally have those letters behind your name that make you an educational expert, PhD, MD, et cetera. There's value in lived experience and that expertise as well. And so just remembering that and understanding that and hearing from community members, I think helps balance me and make sure that I'm stuck in my sort of ivory tower. And I think being in community development at the Fed is really useful in that sense as well.
Thanks so much for those, Anna and Esther, both. Great question from Tim. Thanks for posing it and for being here today. Great to see you. So referencing back to a point raised earlier about people's reluctance to disclose sometimes sensitive or difficult information. I think the examples Esther was giving specifically, revealing that you yourself or your household is food insecure or difficulty accessing consistent access to nutritious food, or something revealing something that's traumatic, or talking about mental health due to stigma. So Tim's question is, both thinking about kind of broadly, but then also specifically, how organizations and folks are trying to capture those variables or detect whether an assessment measure or an instrument has truly told the story or reasonably gleaned about lived experiences that we're trying to understand and support.
So, that's a great question. I think for us, it goes back to when we first started our data journey, two things. One, I think internally we thought that we were utilizing a racial equity lens to do our work because we were primarily a staff of color and we were serving people of color. But there's got to be an intentionality to how you use the race equity lens to the work. And data is a significant chunk of it. And for us, we think about it in person, role, and system. We bring a lot of mental models and biases to this work and how we look at data. I said in my previous comments that, when you see the data in black and white, and you look at the trends, and if I use the example of, that I gave with parents, being satisfied with their children's education, even though the schools are underperforming. So you obviously can't look at the data alone. You've got to dig deeper to get at the story behind the data. So follow-up questions that really dig deeper. Also, disaggregating it is really important too, right? Is there a specific population that's saying that they're satisfied with the data? Is there a certain age group so that you can further refine the data? And again, really digging at what is the story behind the data. Are there certain trends of satisfaction? Are the parents of a certain age group? And then this is where the trust building is so important, because then we're able to get to those questions, those uncomfortable questions that might not be on a simple survey. And, earlier, the quantitative data was important. That's an important piece of this, because sometimes if we're looking at data and we're only looking at the majority, the data that seems to show up being the most urgent, it's easy to forget that sometimes, some of those smaller numbers are actually have a much bigger impact on the community. Those stories are really important, and really digging at the root cause of what some of these challenges that families might be having.
Yeah, as Esther mentioned, it's a loaded question, and it's one of those things that's very, very timely to a lot. And I would like to also talk about, at data.org, one of our program area, the Capacity Accelerator Network, is to train 1 million data science for social impact professionals around the world. And this is a problem that we don't really talk about too, that, a lot of data professionals are based in the global north, the United States, Europe, and that has some implications on how biased data can be. And not a lot of representation right now in the global South. And I think data.org and all of the work that we're doing here in this panel and beyond is very important to bring everyone along in this journey and elevate that voice. Now, and internally at data.org, as we are a very new organization. The organization started in 2020, and I'm actually employee number 6, so it's a very new organization. But as we bring in different perspectives, for example, our new program director, Rhonda Zelenzi Green, she brings in this unique, diverse DEI perspective on just the way we communicate or the way we ask questions. So I remember when we're going through the assessment tool project, like one of the questions that we were grappling, like, should we ask for budgets? Because our funders would like to know how big is the budget for each organization. And then, Priyank, who's based in India, he's like, if you target global South organizations, a lot of those organizations will fall in the smallest budget because of just the nature of the size of their budget. And we're like, oh my gosh, we didn't even think about that. So it's just bringing that and being open about it and having that conversation in an ongoing manner. And I think it's critical to advance this issue.
Thanks so much for the fantastic question and for the insights from your work, both Esther and David, as we think about both the data analysis piece of it, and then also the really real implications for programs, and as we're trying to advance this idea that we are all data people for the folks who are at our organizations and our colleagues, who are taking this information and then tasked with or asked to run with it and to base their program designs and their initiatives, based on some of this data, that those open lines of communication and even just acknowledging some of the shortcomings and not to be making assumptions just based on the data at hand, I think is so critical and so important. So Tim, thanks again for raising it. With an eye on the time, this is actually a part that we've been really looking forward to, and I have to imagine a number of folks are also interested in as well. So we have 4 breakout rooms for you to continue the conversation and engage with our amazing guests, some additional facilitators. I'll say hello and welcome Sophia Poole from the Clark Fox Policy Institute, Katie Christensen from the Social Policy Institute, and again, Sanus Thomas from SPI, who will be jumping into these rooms. So in addition to the large group space, please feel free to make your way over into one of the breakout rooms. You can choose any of the 4. This is not the one where you magically whisk away. There's a screenshot up top of how you can navigate to one of the 4 rooms. So I'll invite, of course, David, Katie, Adam, Jen Rose, Sophia, Esther, Anna, and Sanus to navigate there over now for some facilitated discussion and dialogue and connection points, as we've heard that's something that our colleagues are very interested in. If you're dropping off, wonderful to see you, and we'll see you next time. Otherwise, enjoy the breakout group discussions, which will keep open until 3 o'clock, and look forward to seeing people again soon.